In the beginning, I'd like to explain the difference between the different definitions. Very often I can meet such trouble in definitions in the mind of different students and doctors, which describe that each tumor can be named uh, cancer. That story is absolutely incorrect. That story is absolutely incorrect. Tumor is just proliferation, growing of the abnormal mass. And different abnormal masses can be in our organism. For example, after the operative treatment, we can expect for the formation of the scar tissue. Scar tissue is an abnormal mass, yeah? And actually we can name it tumor too. I have many samples around of that story. That is why be clear in your definitions. If we are talking about the tumor, we are talking about each mass which can be inside of the organism. And that tumor could be malignant and non-cancerous, non-malignant, benign. That is why if we are talking benign, we are talking about non-malignant tumor, but could be malignant, cancerous, and the main characteristic of cancerous type of the tumor is the possibility for the cells to get specific moments. No, first and the main is the possibility to get metastasis, possibility to get spreading, and so on and so forth. Cancer is a cellular growth disorder that occurs when cells divide and spread uncontrollably. And uncontrolled spreading, uncontrolled splitting is the second characteristic of the malignant tumor. That is why tumor could be benign and malignant. Malignant tumor could be named cancer. Not all tumors have the characteristic of malignant tumor. But each tumor, no, most common part of the tumors, can permit malignization in the future, can permit malignization in that or another percentage of the causes. Why? Not because we have different mutations inside of our genomes. Each cell of our organism has genome inside. How many cells we have in our organism? More than 2 billions. More than 2 billions. And that cell should be with the specific program inside, and the program tells that cell can't be alive all time long. Should be renovation of all cells in our organism. For example, let's take red blood cell. The period of life of one red blood cell is just 30 days. It means that from today till August, each of us will get new red blood cells in our organism. Why? Because of they need to die. They can't work good enough. But before death, they need to they need to give new cell, which will get function of the old cell. Splitting of old red blood cell, the splitting of the formation of the new cells in our spleen or somewhere else, can give new cells in our blood vessels. And inside of the genomes, we can find different oncogenes, proto-oncogenes. For the present day, was described more than 100 oncogenes in our organism. And mutations lead to oncogenes, promote cell growth, regardless of circumstances. But inside the genome, we have tumor suppressor genes, which can stop the formation of the abnormal divide. And that genes should inhibit cell cycle if they found that something wrong. And the question is, how does cancer start? Take a look for the period of the formation of the new cell. Each cell should be checked not less than 2 times, not less than two times, for the formation of new normal cell inside of our organs. Possible to do it without checkpoints? No, impossible. And that checkpoints should work good enough, good enough. But someday, all of us can get abnormality inside of that checkpoints. What the next step of the development of that story? Let me show small video to you, and I believe that you will get new information. Так, сейчас, couple of seconds.
Cell to a cancer cell. Take 5
Do you
minutes
hear
to
it,
get the
guys?
picture. More than 60,000 billion cells make up the human body. They are the units.
I need the answer. Somebody hear me?
Yes, sir.
Do you hear the video sound?
Yes.
Okay.
Yes.
That form the tissues which make up our organs, like the liver, heart, and lungs. When the body needs it, our cells split into two and replace those cells that are defective or have come to the end of their lifespan. This makes it possible for our tissues to preserve their shape and their respective functions with the passage of time. Every cell is therefore programmed to multiply and die. This ordered but complex program is controlled by the center of the cell, the nucleus, which contains chromosomes containing many genes made up of DNA. Sometimes, some of these genes undergo a change. The nucleus then sends out abnormal orders and the cell goes wrong. It multiplies uncontrollably and takes on a life of its own. Each new cell produced contains the same defect. The cells proliferate chaotically and form a tumor. This process may be short, but is often long. 10 to 30 years may separate the birth of a first abnormal cell from the appearance of a tumor of about 1 cubic centimeter. The tumor forms many blood vessels in order to survive. These will supply the tumor with oxygen and nutriments, allowing it to live and grow. This is what we call the phenomenon of angiogenesis. The tumor, however, only really becomes dangerous when the cancerous cells begin to invade through the vessels into the adjacent areas and spread to the surrounding organs. These cells can then invade other parts of the body, multiply and produce new tumors. Metastasis is the term used for this spreading process. But why does a cell become cancerous? There are many factors, and they can exist to different degrees. Factors have been identified, such as hereditary genetic anomalies, exposure to some viruses, HIV, hepatitis B, C, and D, papillomavirus, Epstein-Barr virus, exposure to toxic agents, chemical products, radiation, sun, unhealthy behaviors, such as the consumption of alcohol and tobacco, or a diet too rich in fat and low in fruit and vegetables. Today, over 25 million people in the world live with cancer. 7 million die from it each year. The disease represents the leading cause of mortality for those under 65. Lung cancer is the most widespread, followed by breast cancer, colorectal, stomach, and prostate cancer. The means to combat cancer do, however, exist. These often complementary treatments are used alone or in combination according to the type of cancer and its status. The goal of the treatments is to make it possible to eliminate the tumor and cure the patient in early-stage cancer, or like a chronic disease, to control its development. There are mainly 3 kinds of treatment. Surgery consists of removing the tumor in part or in its entirety. Radiotherapy exposes the tumor to radioactive rays, which prevent the diseased cells from multiplying and destroys them. Chemotherapy consists of administering systemic medicinal substances to destroy the cancerous cells or prevent them from spreading. Chemotherapy and radiotherapy act on cancerous cells, but also on healthy cells, which explains their side effects. But today, better knowledge of the characteristics of cancerous cells makes it possible to develop therapies that target the cancer development mechanisms more specifically. Sanofi Aventis R&D is already present in all these areas to fight against cancer on all fronts.
It was the just plan of the formation of the new oncological disorder. And all of us need to understand that chances to get new oncological disorder in our organism actually high enough due to many stories around of us. Mistake can be inside and should be inside the checkpoints. One day, one cell can find the way outside. How do you think how many cells should be killed with help of the checkpoints, with help of our immune system? No, guys, not less than 2 millions, not less than 2 millions. What are the chances to find trouble inside of that story? High enough. And with our age, the chances will be higher and higher. And all of us need to understand that oncological trouble is the big trouble. And actually, we have such opinion in medicine that all of us should die due to oncological disorder. And increasing of the period of the life show us that we have increasing of the numbers of the new oncological disorders in the world because of physiological process of which we have in our organism. Cancer of the endometrium. What's wrong? Cancer of the endometrium or cancer of the uterus, it is similar definition. We don't need to talk about sarcoma of the myometrium because it's a very rare disorder. But cancer of the endometrium is the all-permitted disorder, common disorder. I believe that you remember that endometrium is the organ inside the cavity of the uterus. Don't forget that it's not just a line, not just a line inside. It's a complex of the glands. And that glands can be described with help of histological investigation. We have to view basal level of the endometrium and functional level of the endometrium. And basal level of the endometrium is the level which should be inside the female organism all life long, from the birth till the death. Functional level of the endometrium is just the reaction for the basal line of the endometrium for the hormonal changes. Don't forget that we have menstrual cycle. Menstrual cycle is the physiological changes inside the female's body during reproductive age, and the changes could be described with help of explaining of changes inside the cavity of the uterus. What kinds of steps inside of the menstrual cycle we have? It should begin from the stage of desquamation moment, which called menstruation in the world. What does it mean? It means that old functional level of the endometrium goes outside with the menstruation, with the menstrual blood. And in that day, inside the ovary, we can find starting of the growth of the new follicle. New follicle should produce hormone estrogen. And estrogen is the main proliferative hormone in the female's body. And the reaction inside the basal level of the endometrium is the starting of the growth of the new level of the functional endometrium. Glands of the endometrium should start to be bigger. Structure of the glands should be not such simple, difficult, and connections between the glands should be harder. And growth of that endometrium should be found with help of ultrasound examination. We can check it. We can find the thickness of the endometrium in the first day of the menstrual cycle. It will be 1-2 millimeters, and can find it with help of ultrasound in the middle of menstrual cycle. 14 days, typical day for the middle of the menstrual cycle. And at that moment, thickness of the endometrium will be 9-10 millimeters. So in 5 times, thickness of the endometrium should be bigger. In a moment of ovulation, when the ovule goes outside from the follicle, we can expect for the formation of the corpus luteum. And from that moment, level of estrogens goes down, but level of progesterone goes up because of production from the corpus luteum. And inside the endometrium, we can find next stage of the life of that endometrium, stage of secretion. In that moment, endometrium should secrete specific mucus. What for? Endometrium should be waiting for the penetration, for the implantation of the fertilized egg, for the new pregnancy. One moment when the organism will get the information that the pregnancy is absent, corpus luteum will get disintegration, can't be live anymore. And the level of progesterone goes down, and like the result, connections between the glands of the endometrium will be not such hard, and it will go outside with the new wave of the menstruation. And month by month, cycle by cycle, we have inside the female organism during reproductive age such changes: stage of desquamation, stage of proliferation, and stage of secretion. And endometrium works very hard any month of life of the female. Any month life of the female, it can and should show new proliferative activity in accordance with the activation of the ovaries, in accordance with the increasing of the level of estrogens. And endometrial hyperplasia is the typical premalignant disorder of endometrium. What is it? It's an abnormal, non-invasive proliferation of endometrium. And result of that proliferation will be abnormal vaginal bleeding. How it looks like? Thickness of the endometrium can be 10 millimeters. And if you see that the thickness of the endometrium more than 10 millimeters, 14, 17, we can expect that inside the cavity of the uterus, we have with you a hyperplastic process, just hyperproliferation, hyperplasia. Usually among the perimenopausal and menopausal women. Why? We can explain it. We can explain it with help of very simple understanding. Follicular genesis is the main changes inside the ovaries during reproductive age. And we can expect that the best period for best follicular genetics is the period until 40 years old. After 40 years old, ovaries can show normal reaction for the changes inside the pituitary gland. And production of the estrogens could be higher. We can expect for the increasing of the body weight for the female. Like the result, it will be increasing of the level of the estrogen inside the female organism. Like the result, endometrium can find it high level of estrogens and can show hyperproliferative activity to formate hyperplasia of endometrium. We have such information Why I said that it's premalignant disorder? Because retrospective and prospective studies showed that hyperplasia of the endometrium is the first stage of the development inside the way from premalignant disorder to malignization. And that is why we can name hyperplasia of the endometrium premalignant disorder. What is it? Endometrial polyp, guys? Second premalignant disorder is a local hyperproliferative activity inside the endometrium. And inside of the polyp, we can find with you hypoplastic glands and no specific. That's why it's just same hypoplastic activation of the endometrium, but inside the one locus, inside the one place. Incidence of endometrial hyperplasia big enough. About 133 persons for 100,000 females in a year. Different types of hypoplastic process of endometrium we know, but such type like atypical hyperplasia is typical for old age persons. For your understanding, hypoplastic process of the endometrium is the main reason for such maneuver like dilatation and curettage. And if you're talking about dilatation and curettage, for your understanding, we made in our hospital for the previous year, for 2021, more than 3,000 times. More than 3,000 persons was treated with help of dilatation and curettage, like that. Which is a big number, very big number. And many persons we have with such maneuver in our hospital due to hypoplastic process of the endometrium. Like I said, guys, basic principle is that the increasing of the level of estrogens, hyperestrogenia. During my classes, I was trying to explain that hyperestrogenic conditions actually very common, and that conditions can result not only hypoplastic process of endometrium. We can expect for the formation of another pathological conditions. Now, what kinds of reasons can result in hyperestrogenic condition? Polycystic ovarian syndrome, obesity, nulliparity, early menarche, late menopause, all of them should increase the period of life with estrogen, high estrogen level. And chances for the hyperproliferation due to presence of estrogens will be higher for such persons. I believe that you know. We have with you epidemic of the obesity in the world. And epidemic of the obesity tell to us that we can expect for the formation of the increasing of the numbers of the persons with the such disorders like hypoplastic process of the endometrium. It's a very important. No, we have rare meeting conditions like ovarian tumors which can produce estrogens, tamoxifen using that is drugs with the estrogens. No, don't forget that it's possible. Hyperestrogen condition because of, one more time, reaction for the estrogens inside the cavity of the uterus is the hyperproliferation. How can we classify it? No, very easy. It could be simple or complex and with atypia or without atypia. That's all. That's why could be simple without atypia, complex without atypia, simple with atypia, complex with atypia. There are histological classification, guys. That's why to find what type of hypoplastic process inside the cavity of the uterus you have, you need to take it and check it with help of microscope, with help of specific procedures. Without it, impossible to tell. Yes, we can find it with help of ultrasound examination. We can find it in accordance with our risk factors. But anyway, final diagnosis could be formatted only with help of histological examination. Don't forget about it. And if you have such story like hyperplasia of the endometrium, just need to tell that with or without ATP, simple or complex. That's why how to format it. Simple without ATP, and we have simple hyperplasia without ATP, or complex hyperplasia with ATP. In accordance with our diagnosis, our tactic could be different. Now take a look for the picture. I believe that it's nothing for you, but anyway, for your understanding, simple endometrial hyperplasia, complex atypical. Take a look for the difference. Simple, or just a ball, balls inside, and take a look atypical. Massive proliferative activity inside the hyperplasia. Don't forget that we are talking about not only the thickness of the endometrium. We can find it with help of ultrasound, but how can we understand it with help of subjective knowledge? Subjective knowledge will be around of abnormal menstrual bleeding. That's all. And it looks like menorrhage. It could be metrorrhage. Not typical story is the abnormal menstrual bleeding, which started with the normal menstruation. So menstruation came in time, but didn't stop. Or very profuse. So it's massive. No, and we need to do differential diagnosis with different stories. Neoplasia, atrophic vaginitis, polyps, endometritis, and so on and so forth. Sericitis, and so on and so forth. Ну, guys, да, то есть screening, different information, we have what to do in case if we are talking about hyperplastic process of the endometrium, but the main, of course, is the biopsy. And biopsy, we can do vaginal examination, we can do bimanual examination, history, physically, but biopsy should be taken. And with help of DNC, we can find only final diagnosis. That is why, let me show you one more time what is the dilatation stage.
Your doctor has recommended that you undergo a dilation and curettage, or D&C. But what does that actually mean? The uterus is part of a woman's reproductive system. It's the organ that contains the growing fetus. The cervix forms the neck of the uterus, and the vagina is the canal through which conception and birth take place. The endometrium is a soft lining that protects the fetus during pregnancy. Reasons for having a D&C vary. Most D&Cs are performed because the patient has complained of unusually heavy menstrual bleeding. Other common problems include uterine infection, bleeding after sexual intercourse, incomplete miscarriage, or the presence of polyps. Small pieces of extra tissue growing on the inside of the uterine wall. Then the surgeon will use a gloved hand to conduct a vaginal examination and will check the size and location of the uterus by pressing on your lower abdomen. A metal or plastic vaginal speculum is used to gently expand the vagina and allow access to the cervix. Once the cervix is visible, a forceps is used to grasp the front lip of the cervix, causing the uterus to open a little. Using a blunt-tipped probe, the surgeon carefully measures the length of the uterus and takes a small sample of tissue from the cervical canal. Next, the surgeon will dilate or open the cervix using a series of progressively larger metal rods called dilators. When the cervix has expanded sufficiently, the doctor will use a spoon-shaped instrument called a curette to gently scrape out the lining of the uterus. In some cases, surgeons use a vacuum curette that sucks tissue out through a narrow tube. When the entire lining of the uterus has been removed, the instruments are withdrawn. The tissue removed will then be sent to a laboratory for analysis.
And one more. Так, like that, guys. Just a couple of seconds.
If so, your doctor will place a softening medication or a thin rod called a laminaria into your cervix.
Stuffs we can
The
use to
laminaria
open the
slowly
cervical canal.
expands by absorbing
Or we can
fluid
do it
from
with
your
half of
cervix,
laminaria.
causing your cervix to open. During the procedure, you will lie on your back with your legs placed in stirrups as you would for a standard pelvic exam. You will receive local or general anesthesia. Your doctor will insert a speculum into your vagina, which widens the vaginal canal so the cervix can be seen. During dilation, your doctor will insert a series of smooth rods into the cervical opening. Each rod will be replaced with a slightly thicker rod, thereby slowly widening or dilating the cervical opening so the inside of the uterus can be accessed. Once the cervix has been expanded to about 6 to 9 millimeters, your doctor may perform a hysteroscopy, a procedure in which a small light and camera are used to examine the inside of the uterus for abnormal areas. Next, your doctor will perform curettage, which is the surgical removal of part or all of the uterine lining called the endometrium. During curettage, a surgical tool called a curette will be inserted to remove tissue by scraping or suction. If you are having a diagnostic DNC, your doctor will remove only a small sample of the endometrium and send it to a lab to test for various conditions. If you are having a therapeutic DNC, your doctor will remove the entire contents of the uterus, go home for about...
Так, and it looks like that. То есть we need to take biopsy, guys, да? We need to take biopsy, but we need to see that everything is okay. With help of our vision, with help of our endoscope, which should be put it inside, да? Hysteroscope. No, take a look.
The endometrial lining is visualized here with...
What is it, guys? See that? Just I'll show you. Значит, cervical canal. Entrance inside the cavity of the uterus, external os of the cervix, and cavity somewhere there.
the operative hysteroscope, and you can see that it...
They're trying to check. Okay, so they're inside the cavity. Так. Isthmical part of the fallopian tube. Somewhere there. Take a look. there, and there. One more time, cervical canal. Everything is okay. They didn't find nothing. Absolutely normal cavity of the uterus. Absolutely. Oh, that is why we don't know sometimes what to do. We need to take cells and find present something or not. And the best way, if you're gonna do it with help of visualization, hysteroscopy, да? And with help of hysteroscope, we can find what to do. No, therapy depends on the type of hypoplasia, and our relationship of the female with the fertile function. From hormonal therapy, and when we use progesterone or estrogen inhibit drugs, to hysterectomy, guys. Depends on the situation. I believe that you don't need to know. Так. Да, one more time. A typical hypoplastic process is the risk of malignization in 26% of cases during next 6 months. That is why atypical complex hypoplasia is the indication for hysterectomy. Not progestin therapy. Reaction could be different. Так, okay. Risk factors for endometrial hypoplasia. Take a look for the summary. Everything around hyperestrogen condition. Not obesity, guys. Epidemic of obesity in the world. All countries with the yellow color had that or another numbers of the persons with obesity. Take a look for USA, for Mexico. You see that more than 40% of persons have obesity in there. Very important information, guys. Memorized. What we have done for the years. What we have here. From the 90s, we have increase of the numbers of the persons with the obesity. Так. Cancer of the endometrium. We will continue with you after the break. Let's make a break, 5 minutes. Так, guys. What you need to know about gynecological location of the cancers? We'll take a look for the statistical information. It's a big group of disorders which result in a death of about 30,000 persons in a year in USA. Right to imagine. We have such city in our region like Dmitriev. Numbers of the persons there about 30,000. All of them should die tomorrow, during 1 year, if you're talking about the oncological disorders. Try to imagine, expect. Cancer of the endometrium, the cancer arises from endometrium. That's all. One story you need to remember that abnormal proliferation of the cells can lead in the cancer formation. I believe that you remember the beginning of our lecture. And endometrium is the place where proliferation is a normal story. Month by month, day by day, we're talking about proliferation of the cells. And they can find mistakes in the genome. Statistical information. The most common cancer in the female organism is the cancer of the breast. No lung and bronch, colon, rectum. If you're talking about genitalia, the cancer of the endometrium is the most common cancer in the genitalia. If you're talking about the death, take a look for the place. In a female organism, cancer of the endometrium, not the first place. It's not the inside the first 5 places. Higher than cancer of the endometrium, cancer of the ovary, cancer of the pancreas, cancer of the colon. It means that the numbers of the persons with the cancer of the endometrium big enough, but chances to die are not such big, because we can treat it and we can find it. One more time, we know the logical explaining why female can die, why female can get cancer of the endometrium. We know many stories, many points inside of that trouble, and we can prevent cancer of the endometrium. Different lifetime risk in the different countries depend of, guys, risk factors. You saw picture about the prevalence of obesity, and like the result, in US, chances to get cancer of the endometrium, of course, higher. What type of histological structure? Carcinoma, most common cancer. Could be sarcoma. If you're talking about carcinoma, it could be endometrioid, then squamous, papular, serous, clear cell, and so on and so forth. Doesn't matter. Histological structure result in just a different prognosis. Not most common, it's just typical carcinoma of the endometrium. Adenocarcinoma of the endometrium. Close to 100% around of that story. You need to know the main information that cancer of the endometrium will be divided by 2 big groups, type 1 and type 2. Difference you see at this picture. Type 1, this cancers occurs most commonly in pre- and perimenopausal women, often with a history of estrogen using and hyperestrogen conditions. And before that cancer, we can meet endometrial hyperplasia. If you are talking about type 2, that type of cancer is not estrogen dependent. Older, postmenopausal women, and not have the association with the level of estrogens. the high-grade endometrial cancer, the uterine papillary serous carcinoma, type 1, estrogen-related, young and heavy patients, low-grade, background of hypoplasia, perimenopausal, type 2. About 10% of cancers should be type 2. That cancer is more dangerous than type 1 cancer. And all of us need to remember it. Aggressive, high-grade, unfavorable histological examination, unrelated to